What kind of symptoms do we get? It's a viral infection. So just as with any virus, we get cough and fever in most cases. And obviously maybe some nasal congestion, but really trademarks with lower respiratory. But I think recently there have been some curious cases with some funky symptoms.
Yeah, so for one thing is that some people lack their sense of smell actually with the disease. So for some people that's been sort of their defining symptoms, that they can't really smell anything. It's not a stuffy nose, and that's an important thing to understand, that really COVID-19 presents with lower respiratory symptoms, meaning in the lung, a cough and a fever, sometimes shortness of breath. So the lack of smell is not due to a stuffy nose. Right. And then also, there's been some people, I think more in children, where we're seeing some gastrointestinal symptoms like vomiting and diarrhea as a cause. But again, those are not the most common presentations of this illness.
Correct, yeah. And in children, a lot of moms will start noticing that their kids, regarding to the lack of smell, they would say that, I don't like this anymore, and it used to be their favorite meal, or this doesn't taste right. And so they won't just tell you, I can't smell. There'll be some communication there that you might have to decipher a little bit.
Correct, and that's not necessarily a reason to run to the doctor, probably a reason to give us a call so we could talk you through it. But most of the time with COVID-19, if you have symptoms, the biggest important thing, and they're mild, is to stay home.
Right.
So how do we really work on decreasing the spread? Because remember, I was talking about, Dr. Reymunde, the fact that with COVID-19, one person can infect 3 people, and those people can infect 3 more, and you really have to be careful about spreading it. And all this stuff about quarantining and staying in, and the president talking about, and the health department talking about different ways to stop the spread. So what do we do?
So what do we do? So common sense measures still hold the most sense. We need to practice proper hand hygiene. Not just hand hygiene, proper hand hygiene. So what does that mean? When we wash our hands need to be nice and soapy, and we have to wash for 20 to 30 seconds. None of this 5-second, I'm done mom, I'm done dad. No, 20, 30 seconds, washing with lots of soapy water.
Sing happy birthday twice.
If there's no soap and water readily available, you have to use an alcohol-based hand sanitizer that has at least 60% alcohol.
Correct. And also self-quarantining. So right now, currently as we speak, we're under an order from our governor to stay indoors and limit the amount of time that you have going places and things like that. And specifically, if you have symptoms of a fever and a cough, or just feel sick, you should really be keeping yourself at home and not bringing yourself around other people. The big reason for all this thing is because we want to do something called flattening the curve. And I'm sure you've all heard of this and maybe be wondering what it means. Mm-hmm. But the big concern here is that we don't want a bunch of people getting COVID all at once. We sort of want to spread out the amount of time that they get it. So by keeping ourselves away from other people, distancing, keeping ourselves quarantined, we're hoping a bunch of people don't get it all at once, because then that'll overwhelm our hospital system and our ability to take care of people. So if we spread it out, there's just more chance for us to take care of more people.
Yeah. And that's what's happening in many places. New York comes to mind just because of the amount of people there. But the ERs and the ICUs are getting overwhelmed with patients, and they're running out of respirators and ventilators. And this is what that comes from. We need to stop that big surge and slow the spread so that our healthcare system can catch up to the amount of people getting sick.
Correct.
This will hopefully decrease the mortality rate even more.
And I think we as general pediatricians in the community and even for adults, the general practitioners, have a unique ability here to help out with that. Because if you have mild symptoms and you're concerned because you have a fever or a cough, you could always call your doctor and talk to them, maybe do a telemedicine visit, which is becoming really popular now.
Very popular.
And we could sort of figure out whether you need to go to the hospital or if you just have to stay home.
Yes.
Now, that's not saying if you're having a lot of difficulty breathing or you seem like you're in some distress or feel super ill, of course you want to get to the emergency room as soon as you can. But for milder cases, it's probably best talking to your doctor first to decide what to do before going to the emergency room. Because what if you don't have COVID and you end up going to the emergency room? You could catch it. So it's really important to understand what's going on.
Yeah. Bottom line is, I always tell my patients and you know, their moms and dads, you know, moms and dads, I believe, have this special mommy daddy spider sense thing going on, and if yours is tingling, pick up the phone, call your provider, call your pediatrician, and ask for advice. Ask us the questions you need to ask. We're always open and available to answer your questions.
So if I'm a parent and I'm concerned about my child has coronavirus 19 because he has a fever and a cough, but he's not really that sick, Dr. Reymunde, how do I treat it? What do I do?
So if you're concerned, you know, fever, cough, give us a call, and what we will most likely tell you is, as long as your child is not very ill, it's a very mild illness, we'll go over home measures, whether it be cool mist humidifier, nasal saline if we're congested, little Tylenol if we have a fever, we're very fussy, and to stay at home. Now, if this is getting a little bit worse, you know, 2 days go by, we're not doing better, he's actually starting to have difficulty breathing or anything like that, definitely give us a call first before coming into the office, and then we can possibly either make an appointment for you in the office, or if it seems like it's not a good idea, maybe refer you to the ER eventually.
Right. And unfortunately, with most viruses, there's not a specific treatment for this disease. It's mostly supportive care. And supportive care means treating the symptoms as they come along. So treat the fever with Tylenol or Motrin. If you end up in the hospital and you're getting dehydrated, treating you with fluids. And if you're having trouble breathing, giving you oxygen.
Right.
There are some medicines that are being looked at in trials right now. Specifically, there's an antiviral that's in late stages of clinical trials that may prove to be effective.
Right.
And also, in the news now is hydrochloroquine and chloroquine, which are medicines that have been used in malaria and have been used in rheumatoid arthritis that may play a role.
Right.
But again, it's very early. Some of those medicines may be used to treat people with severe illness, but we don't know if they specifically work in all cases of COVID, and that's going to be, time will tell.
Yeah. The mainstay of COVID-19 treatment or any viral infection treatment is supportive care, like Dr. Kile just mentioned.
Right. And a big thing we have to understand as we're talking through all this, these things that we're speaking about may change as time goes on, as we learn more about the virus. Right. Okay, so if you have any other questions or anything, feel free to call our office. We're here to help out, and everyone please stay safe and practice good hygiene. Good hygiene,
and make sure to be practicing social distancing. I don't like that term, because you can still be social. So let's call it physical distancing.
That's right. There we go.
And close contact, just as a reminder, 6 feet for more than 10 minutes.
Right. That's a good point to make. All right. Well, thank you.
Leave any